So obviously the number one thing is going to be just sun protection. So wearing your sunblocks, avoiding those high UV times of the day, that 10 to 4. We have a lot of golfers, we have a lot of outdoor people. I mean, you live in Florida for a reason. We like doing things outdoors. So it's really all about staying in the shade, wearing the protective clothing, and then of course avoiding those high UV times of the day. So midday, high noon, you want to stay obviously in the shade. Of course, also prevention is just finding these things early. So doing your own monthly self-skin examinations, especially for patients who have just lots of moles, where it's difficult for us when we see you just maybe once a year. If a patient comes in and they're like, this one is definitely new, that really rings true for us, because for a patient to recognize something, it's usually a pretty drastic change. So doing your monthly self-skin exams. We're going to be talking about the A, B, C, D, E's of melanoma. I'm sure you've probably heard about that at some point in just the media. And of course, I think is actually even the most important thing is the ugly duckling. So you have, 100 moles. All of a sudden one that just sticks out from all the rest. We call that the ugly duckling. That's usually the one that is misbehaving or doing something where it's changing, where we need to take a closer look, and we'll talk about what we do to take closer looks here very shortly. And then of course an annual skin exam, sometimes even every 6 months or every 3 months, depending on a patient's history, personal history of skin cancer, is extremely important by a dermatology professional. So the first thing obviously is the sunblocks, and we have some free samples for you today. We have a list of all the recommended sunblocks that we recommend, but at least an SPF of 30. A lot of patients are like, oh, my makeup, it's got an SPF of 15. That's great, at least you got something, but we need that sunblock on underneath that makeup. So definitely at least an SPF of 30. We recommend that broad spectrum. So these are kind of the key phrases you're going to want to look for on your sunblock. So broad spectrum, UVA and UVB. Excuse me. Amy just talked about the importance of both of those. The UVA is that deeper penetrating. The UVB is what's causing all the burning. So you want both UVA and UVB. And thankfully, with regulations now, the sunblocks are a lot better. They used to just have one or the other. Now, for the most part, they've kind of covered
I've heard
both.
in the news, etc., recently that we're way behind Europe and other countries with the sunblocks.
Correct.
I don't know what the ingredients are, but why isn't FDA or somebody saying, hey, come on, let's get the...
Exactly, and I think that's the changes that have just recently occurred, even over the last 2 years. They're trying to finally promote the right kinds of sunblocks and making sure that these companies aren't saying, sunblock, and it's not really blocking the sun. So we're finally regulating that a little bit, like you said, through the FDA. But you're right, a lot of the stuff that we do here, Australia, obviously that's like the skin cancer capital of the world. You're right, you said, they're a couple steps ahead. But we're finally catching up because we're finding about how important these things are in preventing stuff down the road. So the big thing I always find with patients is, oh, I wear my sunblock. I'm like, okay, well, how much do you put on? Just a spray here, a spray there, and that's it. But really, you need at least 2 tablespoons of sunblock. So that's a good amount, when you're putting on. So the main thing I try to preach is not only reapplying every 2 hours, but also making sure we're putting on the right amount, the correct amount. So that's extremely important.